We've been established since 2017. We're like the first to really do this work, and so longest running. Our mission has really been education and facilitation, getting veterans to this treatment. The way I view it is it's a triage state. Ideally, we'd like to work with people earlier on, but right now the problem's so bad, we're just trying to prevent suicide. We're trying to get them back into a state of hope, back into a productive member of society state, but it's just massive amounts of trauma out there. So, okay, what can we do for people who are seeking this? Let's safely get them there because they are seeking it in mass, and I'd like that they go to spots where they're actually getting that. Beyond that, we also do research. So working with a few universities, the current one is University of Texas, Austin. So we're doing 3 studies with the Gold Star wives with psilocybin, veterans, military veterans with ayahuasca, and veterans with traumatic brain injury, special ops veterans with ibogaine. So those are going on right now, as well as some other studies with different universities, Columbia University, Imperial College of London, and then policy. So we're working with different initiatives on a statewide basis just to bring the veteran voice to those policies. We worked with Oregon to get that passed, just allowing us spots where we can actually figure out how this works, and also ideally in the future not have it to where we have to send every veteran overseas, right? If we can do this domestically and build those localized communities, then that's the goal. Our biggest focus is, what do psychedelics look like in the US in the coming years? What can we do as a nonprofit to foster that, to allow communities to develop on their own, but provide them the necessary support, education, and intellectual property that we've developed to make that happen. So ideally in the future, if a veteran has their therapist to the VA, but they want to go to a community psilocybin circle with a group of veterans to get that healing, then they can do that, but they also have the tools to know that it's safe and who are trained facilitators, all that kind of stuff. So that's where we're going, of how do we make the community dynamics in the veteran community have really collapsed. And so we're trying to rebuild those ecosystems, those communities. And so just trying to figure that part out. With psychedelics will be a part of it, but it doesn't necessarily need to be the only part of it. For us, we're a federal nonprofit. We're a nonprofit in the US. We have a branch in Canada and UK, but in the US, like any nonprofit, we completely rely on donations. We provide financial grants to all the veterans that go. And so that's always the case of the more veteran, like I said, we have a giant wait list, and it's really just the more donations, the more support we have on that, the more we're able to serve those veterans that are coming to us that have been essentially left behind by the VA. And so that's that kind of support, or just any people that can support other ways of just promoting the message, getting it out there.